Good evening. I come from an organization where CSR has into DNA since Mother Teresa was one of the inspirations for Dr. Initiative to founded the organization. In the Rajasthan context, I'm coming from Bangalore. So in the Rajasthan context, I would like to share a few things. Though we have a hospital here in Jaipur, but apart from Jaipur, also in other places where we have been doing certain activities and on the CSR front, and which probably, I don't know if they can be replicated or not, but there could be some learnings out of that. So when we are looking at CSR, the way we approach CSR is it is about affordability and accessibility, right? Like Dr. Shetty always says that a solution is not a solution unless it is affordable. If a large number of people cannot afford that solution, it is not a solution at all. So one of the initiatives which we have done a few years back is a micro health insurance scheme for farmers in Karnataka, which was an idea floated by our organization and subsequently adopted by the government of Karnataka and is now administered through a trust, where all the farmers who are part of cooperatives in Karnataka pay 18 rupees a month for access to 2,600 surgical procedures across all network hospitals and all major corporate and non-corporate hospitals in Karnataka. So that is a model that has been very successful and has supplemented the government in its own healthcare schemes. So, insurance or micro-insurance of providing the cost of healthcare over a large mass of people is something probably, states like Rajasthan could look at. The other thing is about accessibility. When the obvious paradox in India is that 70% of doctors are there in urban India, while 70% of patients are there in rural India. So how do you reach, how do you ensure that people in rural areas, people in inaccessible areas have enough access to healthcare? So at NH we have used a whole lot of technology trying to do that. Many years back we set up a telemedicine system around this. But subsequently, the recent past, in the last 1 year, we have given that entire process a revamp, and we are working with like-minded corporates. HP Global has partnered with us in providing fully equipped telemedicine centers. We have now, at this point of time, around 22 such telemedicine centers, which are essentially primary centers connected to our super specialty hospital on the HP cloud. So that is something we are seeing good traction, and where even people in the rural areas are willing to pay for healthcare. It is self-sustaining and it is a scalable models. So I think accessibility is important, affordability is important, and the third most important part is the partnerships. It is very important when as a healthcare provider, I can say that one is looking at providing accessible, affordable healthcare, especially on the CSR front, partnering with like-minded corporates, especially with the government across multiple states, is extremely critical. We have one such partnership with the government of Assam, which is for pediatric cardiac surgery for poor underprivileged children, and which has over the years now morphed into the first corporate hospital in the northeast with Naryana Health, NRHM, and the government of Assam being part of it. So, these partnerships are extremely important, even with the private sector, the private companies using their CSR teams. We feel that the entire CSR models of affordability and accessibility can be really taken up to a different scalable level. Thank you.